It is the first Impact Collaborative of 2024, and I'm in a mastermind, and they make me pick a number, and mine is fierce. And I have a second byline, and that's alignment. And I could not be any more excited than being in alignment with our brilliant leaders and storytellers who are with us today. We're amplifying stories about what happens when we don't get to make choices for ourselves. And I know that that is a subject that does not only affect our health and well-being pillar, but also leadership, economic mobility, and freedom from violence. So this is a thrilling commencement to 2024 with one of our 4 programs, Impact Collaboratives. And we'll talk a little bit more about the other 3 in a second. But first, let me thank these genius board members who are here with us today. Yes. I know Zoom fails us, and we do have to set up this way, so you're not seeing them all, but many of them are here in the audience with you, and we thank you for your service and your leadership. You're each and all amazing. Also, the incredible elected officials. We have quite a few people signed up, especially representatives of different elected officials who are going to be with us today. Our community partners and direct service providers who do the real work. And as everybody knows, fuel and funding our mission is just as important. And all these different roles, that is a key and critical role. So many of you donate large, many of you donate small. Fueling our mission makes you a key and critical part of that mission. So thank you each and all. So we're going to race through here because we've got a bunch of genius people. Our second program I mentioned before is data and research, and the wonderful Viviana Alvarado Pacheco. Happy 2024. Please take it away.
Good morning, everybody. Thank you for being with us today. I'm going to give you a really brief snapshot into our health and well-being score for the Gender Equity Index. For 2021, the score was 43 points. So as you can see on that little image that we have there, we're not doing too well. Miami-Dade County is 57 points away from reaching equity in health and well-being. Some of the factors that we included were access and ability to have health insurance, as well as maternal morbidity, infant mortality, and those were the 3 that we considered. Additionally, if you want more information on everything that we included for the health and well-being score, there is a paper that you can access. Cami, next slide, please. Using the QR code here, it will take you to our Gender Equity Index page, and this is the policy paper that we did on it. Additionally, for this Impact Collaborative, we added in some data from 2010 to 2022, tracking the induced terminations of pregnancies in Miami-Dade County. So you can see that there has been a steady decline even from 2010 and even before the Dobbs decision. So something to keep in mind, something to consider as we go through this Impact Collaborative today. Thank you so much.
It's incredibly important, the work that Vivi and her team are doing. It makes women and girls visible, makes women and girls visible. So that's not easy to get research, and our data and research team and program are absolutely critical. So thank you. Oh, Anna, I have to say here, I think I want you to be president. That's a fan. Thank you for all the work you do. I'm not going to steal any of your 8 minutes that you have. Please take it away as our keynote. Thank you.
Hi, everybody. How are you? Thank you so much for inviting me. I've always been a fan of the Women's Fund, and I'm excited to be here to talk. I don't want to step on anybody's toes. I want to be clear from the very get-go. I'm not a doctor, so I'm going to be talking about medical terminology. I'm going to be talking about how these things play out, but I think I'm going to be talking from the shared perspective all of us non-medical professionals have, and using the common terminology that so many of us use out here on the street. And that's exactly one of the points that I'm going to make about why abortion bans are something that every single person in the state of Florida and in Miami-Dade County should be concerned about. I'm going to try and frame the issue in a political and policy way and let other speakers talk more to the practice of actual reproductive health care. So the first thing to do is to make sure everybody understands that Florida is currently living under a 15-week abortion ban without exceptions for rape or incest. In the last legislative session, the legislature passed a 6-week ban. The governor signed that ban, but the 6-week ban is not yet in effect. The 15-week ban was challenged by the ACLU on the grounds that it violated Florida's right to privacy in our Constitution, and the Florida Supreme Court has not yet rendered its decision in that case. But the way the 6-week ban was written, once the Florida Supreme Court finds the 15-week ban constitutional, it will trigger the 6-week ban, and 30 days later, the 6-week ban will become the law of the land here in Florida. So I simply want to lead you through some understanding of what abortion is in this context, how the numbers play out, and what that means for Floridians when we bring it closer to home. The first thing I want to focus on is the concept of abortion. It's a very loaded word, abortion. So often there are value judgments made on the circumstances of conception, which is one of the reasons why you see abortion bans written with exceptions for rape or incest or the health of the mother, because these value judgments over the circumstances of conception often play out into policy. And one of the effects of these value judgments over the circumstances of conception is that we have, as a culture, have created a number of euphemisms to discuss abortions in different circumstances of conception or in different health crises for the mother. So you have miscarriage, sort of a natural pregnancy loss, which can happen at some point during the pregnancy. You hear people talk about spontaneous abortion, which is often referred to as miscarriage, stillbirth, which happens much later in the pregnancy generally. You have induced abortion. You hear people talk about termination. You hear people talk about D&E, DNX, dilation and extraction. You hear people talk about treatment for ectopic pregnancies. You hear people talk about incomplete miscarriages, for example. All of these, when it comes to abortion bans, are abortions. All of this, which is a common experience for women of reproductive age who are starting their families, all of these circumstances are affected by abortion bans. It does not in real life play out that we are able to separate out women who someone in government feels has an appropriate circumstance of conception or an appropriate reason for needing reproductive health care and perhaps needing medication or a surgical termination. It all gets put into the same hopper. And that's one of the reasons why often we find a disconnect between people who support access to reproductive health care, but have real issues with elective termination of pregnancy. It's important for people to understand that when the rubber hits the road, those sorts of distinctions don't play out very favorably in emergency rooms, in hospitals, and in doctors' offices across the state. The next thing I want to focus on is the numbers around pregnancy. And we talk about miscarriage. Most people use the concept of about 30% of all pregnancies will end in miscarriage, in spontaneous miscarriage. I've seen data that says anywhere up to 50% of pregnancies will end in spontaneous miscarriage for whatever reason. That's an incredibly high number. It's a common number. What it means is that the vast majority of women, whether they know it or not, have had a miscarriage. Let me reiterate that. The vast majority of women, whether they know it or not, have suffered a miscarriage at some point in their lives. And we know from the World Health Organization that about 1% to 2% of pregnancies will result in a non-viable fetus. So 1% to 2% is a very small number, but it plays out in Florida in ways that are tremendously impactful. Florida has about 23 million people in it. That includes a little bit over 4 million women and girls of reproductive age based on the last census. And Floridians have about 250,000 live births every single year. So if we go back and do the mental math exercise of saying 1 to 2% of pregnancies will result in a non-viable fetus, what that really means is that every year in Florida, between 2,500 and 5,000 women will find themselves carrying a non-viable fetus and subject to abortion bans, meaning they will likely have trouble getting care currently after 15 weeks, but likely in the future after 6 weeks. And that is a tremendously dangerous circumstance for every single family in Florida, because as we've noted, every single woman who is of reproductive age may find herself in this circumstance.
That's
So
so powerful, Anna.
it
That's
is
great.
indeed. And Florida is an important center for reproductive health care. We are the #2 provider of terminations in the nation. Only California has more terminations each year. We have traditionally been a regional center for access to reproductive health care because of a couple things. Number one, when Roe v. Wade was the law of the land, we had a specific right to privacy in our Constitution, which meant that access to abortion was part of the political reality of living in Florida. And for many women who lived in our region, in the southeastern part of the United States, Florida became the place where you could go to get reproductive health care, where you could have an abortion. And for many women in Miami-Dade County, they found themselves luckily in a place where they could get reproductive health care. Other parts of Florida show patterns of people having to travel very long distances, often to the southeastern part of the state, in order to get reproductive health care. All of that movement, I think of it as being sort of domestic medical refugees, has been part of the Florida reproductive health care landscape for many, many years. What we're seeing now with the abortion bans in Florida is that the medical refugee scenario requires women to go as far away as Virginia or Illinois in order to get appropriate modern reproductive health care. So we're seeing tremendous expense, tremendous differences, distances, huge impacts on families and on individuals. So what we really want to focus on, I think, from a political standpoint, is that given the fall of Roe v. Wade with the Dobbs decision, groups in Florida got together and decided that we needed to create a constitutional amendment which would prohibit government interference with abortion. That because of this confusion around what is an abortion, what is a miscarriage, what is a pregnancy loss, what is a non-viable fetus, the only people who can really understand the medical necessity of the situation are the women and girls who are patients, their families, and the healthcare providers who are providing them this care. So a constitutional amendment was drafted, the first sentence of which reads, "No law shall prohibit, penalize, delay, or restrict abortion before viability or when necessary to protect the patient's health as determined by the patient's healthcare provider." That language will qualify for the ballot. And we will have oral arguments before the Supreme Court on that ballot language on February 7th at 10 a.m. So if anyone is interested, you can go to Tallahassee and see it in person, but you can also live stream it. We'll be providing a link on our website so that anybody who wants to live stream those oral arguments can. And we believe that it will be on the ballot in November 2024, and that Floridians will have the opportunity to amend the Florida Constitution in order to prohibit government interference with abortion.
Thank you.
My group is called Florida Women's Freedom Coalition. We are part of the umbrella sponsor of this constitutional amendment, which is called Floridians Protecting Freedom. And we work with donors and supporters across the state and across the nation to bring the resources in to begin what will be a statewide campaign during a presidential election to make sure that government interference with abortion does not become the law of the land here in Florida. So
Thank
that's my
you.
contact information.
Amazing. And we're going to share it with those of you who answer in the poll also directly. So our team will also help that. And Anna, we really hope that we have time in the Q&A that you can come back. I know we're going to have a lot of questions for you. The stories, you've given a perfect framework today for the stories. And our amazing panelists today are going to share just a few in the few minutes that they have. We have a brilliant board member, Danielle Prendergast, who also used to work for the ACLU, who also is incredibly involved in both state and her Central Florida Ruth's List, which works with supporting candidates who also are pro-choice. So for that reason, Danielle, we thank you for moderating this portion of the panel. Welcome. And I see that you're still on vacation, but still here with us. Please take it away.
Good morning, everyone. I bring you greetings from Kingston, Jamaica. It's such a pleasure to be here. I want to dive right in because, as Maria said, we do have three really amazing panelists that I want everyone to hear from. And so I'm going to ask each of our panelists, starting with Ashley, to do just a brief 2-minute or so introduction and tell us about yourself and what brings you here with us this morning.
Thank you. My name is Ashley Walker. Thank you to the Women's Fund for hosting today. And thank you to Danielle and Anna for moderating. I am a public affairs professional. I am a women's advocate. I do my work through Florida Women's Freedom Coalition and Floridians Protecting Freedom. And that's what brings me here today. But most importantly, I'm a wife and I am a mom to my little toddler Remy. So, which he shares a lot of my journey and my story that I'm going to share with you later today. So, thank you so much, Danielle.
Thank you, Ashley. Betsy, would love to hear from you next.
Good morning, everybody. Thank you so much for organizing this panel. I'm really excited to be here and hear what everybody's doing to support the rights of women's health in our great state of Florida. So like they said, my name is Betsy Londono. I'm an abortion navigator currently at Planned Parenthood Southeast and North Florida. As you can see, I don't think Planned Parenthood needs any introduction or explanation for what we do, but as you can see, our affiliate is a little wonky. We do all of the north of Florida and then all the way down the south coast, all the way here to Miami, which is where I am based. I started my career in women's health right out of college and grad school. My first internship was at the National Organization for Women in New York City, where I did a lot of work with Planned Parenthood. And then I moved to Miami. I have 3 kids that really inspire me to pursue this work. And I was a medical assistant at Jackson for a while, working in OBGYN. I was a volunteer on the Women's Emergency Network here in Miami. And so for about the last year and a half, I've been with Planned Parenthood. And so, yeah, you could say my life is always working for women.
We understand that at the Women's Fund, absolutely. And Derek, last but absolutely not least, please tell us about you.
Hello, guys. Thank you for having me here this morning to speak with you. Me and my wife, we experienced this firsthand. I went from almost losing my wife, to something that was so devastating, to our country, to being in the White House, being at the Capitol, talking with men for choice, spreading awareness. And my wife, she keeps her hair appointments. I'm actually in front of the place where standing out in the front, and my wife is in the truck. We have our little 4-month-old nephew and our 7-year-old niece that we watch on my days off. So I'm working and I come home, I'm uncle/dad. And we actually in front of their hair salon where my wife almost lost her. So I haven't been there since last year when I first time. I don't know how I'm gonna feel once I go inside the hair salon, but I know it's gonna be kind of weird to go back inside of there. But you know, I'm happy to be here and spread awareness. And I do want to get, you know, more men involved and more people involved so they can understand what's going on in the state of Florida and across the country. Because this shouldn't happen to, you know, no women in this country. And I almost lost my best friend, so I can't go through that again, and I don't want anyone else to go through it.
Thank you, Derek. We so appreciate your story and you being here. I want to just sort of remind folks that I'm going to ask the panelists a couple of questions, but as they're talking, please put your questions in the Q&A or put them in the chat, and we will get to them in just a few minutes. I wanted to start. I think the beauty of this panel is that each of you are coming from different perspectives and have different vantage points. And I would love to know from each of you, starting with Ashley, what are you seeing? What is happening on the ground from where you sit? What are you seeing? What are the stories that you're hearing?
Yeah, I mean, one of the things that really terrifies me right now is this extremely restrictive 6-week ban. I think, as Anna pointed out, there's a lot of misinformation out there around like what is abortion and what does it mean and what all is included in it. I personally have had a very long road to have my son. My husband, I had a very successful professional career and decided to kind of try to have babies a little later. I was in my mid-30s. And it was a long road. I went through, before having my son, I went through 14 cycles of IVF, and it was on my 12th cycle that, I had my experience for the first time with like what can happen with a pregnancy. It was the first time I had ever tested positive. So we were elated after 12 cycles and thousands of dollars. We did all the appointments, all my numbers were going up, and it was time to get an ultrasound. And when I went in for my ultrasound, the doctor could not hear a heartbeat, but my numbers kept going up. So for the next day, my numbers kept going up. So the next 48 hours ended up being a pretty much of a whirlwind. I ended up having a DNC, which did not stop my numbers. My doctor thought maybe I just had a miscarriage. That was not the case. My numbers kept going up. I ended up in for emergency surgery over the weekend. Went in and he said, I have no idea what's going on. I need you to sign documents that I can remove all of your female parts, which was very emotionally devastating for me as somebody that was trying so hard to have a baby. I ended up having an ectopic pregnancy, and I had one tube removed. I thought my journey ended there, at least with that experience. It did not. My numbers kept going up. Within the next 48 hours, I landed myself in the hospital again and went through 2 treatments of chemotherapy to really rid my body of any cells that were there, any kind of biological mass. It was very traumatizing. And my husband and I decided that we wanted to keep trying. On my 14th cycle, I got pregnant and had my son. So it was a blessing. But what that experience taught me is that, people think of abortion as some irresponsible woman went out and got pregnant and now doesn't want a baby. And that is not the case. Abortion is healthcare. I am terrified that a woman in my situation or a similar situation, their doctor, once the 6-week ban passes, a doctor will maybe not do that DNC, maybe not go into that surgery until they feel like the woman's life is adequately at risk. And that terrifies me. women, our healthcare shouldn't be second to some law because a bunch of people in Tallahassee made a decision to define what our healthcare should be. And so my story has really caused me, my story, my experience, and then the fall of Roe v. Wade, it was that day after that came out, I was sitting in my son's room and I just started crying because for the first time I had realized I had an abortion story. I'd never looked at it that way. I looked at it like I went to the doctor and I had care that I needed and I got that care. But it was the first time that I realized that, I share the story of many other women. And so what I'm seeing is that our government is becoming more restrictive and we as women got to come together to do something about it. And so that's what terrifies me. That's what I'm seeing. And that's why I'm here today. And I want to thank the Women's Fund for bringing all of everyone together to be able to share these stories and learn from one another. So thank you.
No, thank you. I just want to echo Maria's comments about we are so honored that you are bringing this story to us. So thank you. Betsy, from the Planned Parenthood perspective, what is happening from your perspective? What's going on? What are you seeing?
So while it was mentioned, yes, we're still in the 15-week ban. We have been anticipating the 6-week ban for, I guess, like the last 6 months. We've been anxiously preparing for it, working with our partner affiliations all over the country about what we're going to do when this happens. But as of now, Cami, is my map up? Can I have the slide with the map? Okay, so you can see the states that we mainly are seeing patients, a major influx since these bans started after Roe v. Wade. All of our surrounding states at the moment have some sort of abortion ban. So our clinics in Tallahassee and Jacksonville are amazing because they are taking the overflow, as you can see, from at least 6 surrounding states. So what we do primarily is offer any type of logistical support we can, additional funding for the patients to have their procedure costs covered. So we are just seeing right now, dealing with all of the influx of the patients coming to Florida, and at the same time anticipating what's going to happen when the 6-week ban goes into effect, and our job basically being flipped upside down, and then we're going to have to be navigating patients away. And in addition to that, we also do help the women that are past the 15-week ban and navigating them to Virginia, New York, Illinois, to other states. So we are really seeing like both ends of this abortion desert happening in Florida.
Thank you.
Yeah, okay. So I can see here on our slide. So yeah, we're just waiting to see what's going to happen when the 6-week ban goes into place, and we are actively preparing for when that happens.
Absolutely. Thank you. Derek, I want to thank you for one shining light on you and your wife's story. Thank you so much for that. And for also showing that this is just not a woman's issue, that this affects men, it affects entire families as well. So I applaud you and I thank you for that. From that perspective, what are you seeing? What is the story that you want to tell around this that you think that we need to be aware of in terms of what's happening?
I think you're muted, Derek.
I'm so sorry. Can you hear me now?
We can hear you.
Okay. I just want to say to the man who may not think that there's an attack on abortion care and it may not impact them, it will, it definitely impacted me and my family. And I hope that, my story may, help other men, join this reproductive freedom, because we need as many men as possible. I'm happy for Men for Choice to, take me in and show me that, I can fight as well. I always wanted to fight, but I didn't know how to until Men for Choice, they showed me. But you know, sometimes I wake up in the middle of the night thinking about this, and it bothers me a lot. Sometimes I have triggers, and you know, I have my moments where, you know, if I'm by myself or whatever, if I see something that reminds me of what happened and what we're fighting for, it's a big trigger. So, you know, I'm happy that, you know, you guys has got involved with this, and that we're all doing something about it, and we're not just letting it sit.
And you know, Derek, you're so right about not letting it sit. And so now that we know more, going back to you, Ashley, what can we do?
Well, I think the first thing is encouraging people to share their stories. I think a lot of people have a lot of misconceptions of what an abortion is, and just through different stories, you find out that it is a widespread series of healthcare. And there's a lot of reasons and circumstances that women fall into these situations where sometimes they have to make that choice, and sometimes they have no choice at all. And it is just a matter of the circumstances and getting to the other side of it. And so, one, I would encourage everyone to share their story. The second, you know, I do work with Florida Women's Freedom Coalition, and I would encourage everyone to visit our website, follow us on Facebook and Pinterest and Instagram. And as we go into this year, you know, this is going to be on the ballot, and there's going to be an opportunity for everyone to have their voice heard on this, and we'll need to mobilize everyone. But in the meantime, we need all these women across all political spectrums, across all diverse types of stories, across all communities, to share their story, so that people hear that this is not a partisan thing. This is not a, you know, this is something that affects everyone.
Absolutely. Uh, the polls have been popping up, so please participate in those. And if you have any questions, put those in the Q&A or in the chat. And we'll get to that in just a few minutes. Betsy, from Planned Parenthood's perspective, what can we do? How can we help?
So just to tell you a little bit about our patient navigation program, which is what I think is driving, you know, all of this. We, at the moment, so how sorry, I'm getting a little confusion or interference in my thing. So what we're doing constantly is helping the patients that are coming from out of state to Florida. So anytime you can donate to any sort of local abortion fund, that is what we rely on the most, because while we can help patients as much as possible logistically and financially, we are always needing an overflow. There are always patients that are coming from, say, from Texas, from Louisiana, who are having to travel upwards of 600 miles. And because of the 24-hour waiting period in Florida, sometimes their appointments are not able to be back to back. We do everything we can to have them seen as quickly and efficiently as possible. There's childcare issues, there's travel issues, there's domestic violence issues, all these things that these women are facing. So that is what we're working to overcome with the patients on a daily basis. I mean, we have patients, like Ashley was saying, patients that are in Georgia that have a fetal abnormality, and they want to elect to end that pregnancy. And so they're coming from Georgia, from North Carolina to Florida. So we really are like a beacon at the moment still for all of the Southeast.
Yeah. Derek, can everybody still hear me?
Yeah.
Perfect. Okay. Derek, I'd love to hear from you. What can we do, especially for those folks who think that this issue might not directly impact you? What can people do to help?
You get out and vote, you know, they can get out and vote, help us, you know, put this on the ballot. They can actually click on the links that's on our website to, you know, if they want to donate anything, they can help in that way. If we have any events or anything that's around in Florida or something, if they know that it's us, help us join us, help us get this movement going and keep people aware.
Awesome, awesome. I would love to move us now into the Q&A section. And Anna, I would like to invite you back into the conversation. And I know our first question in the Q&A, Anna, I'd already addressed that, but I was wondering if you could just go back to that for just a little bit, especially for those who didn't see that. And the question was about how will DNCs be offered with the abortion ban? What guidance is being given to providers to determine the best candidates for that procedure? So if you could just talk a little bit about the answer that you gave in the Q&A, that would be great. And anyone else who has questions, please, now is the time to put that in the chat or the Q&A.
Yeah, I mean, so what's important to understand, I think, for all of us is that the people who are writing the abortion bans are not using medical language. They're using all kinds of common language, which may not be particularly clear. In fact, there are certain people who believe it's meant to be unclear so that they don't have guidance in hospitals, in clinics, and in doctors' offices on when pregnancy terminations are legal and appropriate. As a result, most hospitals and doctors tend to interpret these abortion bans as broadly as possible. Many of them contain provisions that subject doctors to criminal prosecution if they perform an abortion when they shouldn't. And because of that fear of criminal prosecution, often the services are simply not provided at all. Sometimes you're seeing bans coming up in different states. For example, Missouri just had a lawmaker propose a law which would explicitly prohibit the treatment of ectopic pregnancy. So Ashley's case, and we all know that an untreated ectopic pregnancy will likely result in the death of the mother. It would prohibit it in the state of Missouri quite explicitly. So there will be no guidance. Jessica Valenti is a fantastic commentator. She writes a Substack called Abortion Every Day that tracks abortion bans and abortion politics in states, in all 50 states. And she makes the point frequently that these abortion bans are written in vague terms, in non-medical terms, so that there are no exceptions. Not using the exceptions is the point. And she makes the point that it is a political false flag to begin to insert exceptions due to the circumstances of conception, rape, incest, et cetera, or to use these vague, non-medical health of the mother terms because they're so vague, so undefined, so meaningless to people who are actual trained medical professionals that they're impossible to use. So the classic question is, exactly how close to dead does a woman need to be in order to qualify for a termination? Is 75% dead close enough? Is 50% dead close enough? Is 25% dead close enough? How exactly can any medical professional apply the health of the mother in these circumstances? So I think you've hit the nail on the head. All of this, right, is meant to be impossible to use. And the results of that can be quite devastating for women in real life.
As you are all typing your questions in the Q&A, I just want to take an opportunity to ask, you've all been really super clear about what terrifies you the most, the 6-week ban and just all of the other possible bans that, Anna, that you just spoke of. Are there any opportunities to be optimistic? Is there anything that, looks like we're not, I don't know what the word is, but any opportunities to be optimistic about what's coming around?
Absolutely. The fact that the Floridians Protecting Freedom, which Florida Women's Freedom Coalition is part of, has submitted 1.4 million petitions asking to get a constitutional amendment on the ballot that would protect access to abortion and prohibit government interference. That's an unprecedented number of petitions. Upwards of 10,000 volunteers have been out there collecting petitions across the state. Over 200 grassroots groups We're seeing passionate engagement on this issue from people who often don't engage with the political world. Young people, people I consider sort of lazy voters. They only vote in presidential elections, or they only vote when there's something big on the ballot. Access to normal, modern reproductive health care, including abortion, is something that gets people passionate. And that is invigorating to see, because what we're finding is that when people realize that their own families, their own daughters, their own wives, the people that they love are at risk, they act. And that makes me happy about Florida and about the future that we can create for ourselves.
Betsy, Ashley, Derek, what are the opportunities for optimism that you are seeing?
I'll go. I see the optimism in the community. I see women that are needing help accessing care in Florida, and I see an outpouring of funding, of people offering their services. I have women like, what can I do? How can I help? Can I babysit? If they need to bring their children to the clinic, like everybody just seems to want to help in some way or another. So I really feel that if this gets on the ballot, that we're going to be successful, and I feel very hopeful.
You know, I feel the same as well. There was a few times where I spread this story out with people that I didn't even know. I just walk up to them and, I asked them how did they feel about the abortion bans. A lot of people didn't know that this was going on in Florida. And I am so grateful that we have 1.4 million signatures. When I was out collecting petitions with Man for Choice down in Miami, it was hard. Like, people was giving us the cold shoulder. Uh, it was people that would do it, but they wasn't from Florida, but they rocking the Miami Hurricanes jersey. I was like, wow, y'all, you guys love Miami Hurricanes more than we do. But there's people that really want to get involved. And, what I would do is send them to, the link to sign up for the petition and stuff, make sure that they're registered to vote in Florida. That was one way that I can, assist in helping them. But just like you said earlier,
One other thing I wanted to throw in, another avenue that I see is going to be really helpful. The next generation of kids coming up, this is affecting them in a really, really serious way. So I see a lot of conversation going on with teenagers, with college age kids, with high school age kids. Like, they really seem to be getting involved in this, because I think for the previous generation, abortion rights were just kind of a given. They were always there. It wasn't really on their radar. And like I said, I have 3 teenage kids, 2 are in college, and this really seems to be a big thing on their plate and something that they're passionate about. So I do feel very hopeful that the ones that are going to take on this baton and the next generation are really going to push to turn this around.
Yeah, exactly.
We have a question from Antonia. Vivi, can you read Antonia's question for me, please? I can't quite see it.
Of course. The question is, what percentage of abortions are due to fetal abnormalities, and at what stage of gestation do these occur?
Well, I don't know the percentage that are due to fetal abnormalities. I'm not entirely sure that there's any entity out there tracking, although the Kaiser Family Foundation might be able to have that data. You might also look at the World Health Organization. They often have country breakdowns. I think fetal abnormalities can be identified, because there's a difference between them occurring and being identified at almost any point. But the fact of the matter is that the vast majority of abortions happen in the first trimester of pregnancy. Less than 1% of abortions happen during the 3rd trimester of pregnancy. Those cases are generally the most extreme, most awful circumstances that you can possibly imagine. These are people who generally very much want their children and find themselves in a real crucible. I think the only people in those scenarios who can make the right decisions are the families and the healthcare providers. That's exactly the kind of circumstance where you don't want the government involved. We tend to overstate how common those are, especially people who are against abortion access. And I think ultimately the most important thing that we can do in order to motivate people to engage is to rip a little bit of the stigma around abortion off. Once we start recognizing that ectopic pregnancies are abortions, miscarriages are abortions, the medicine that is used to treat all of these common medical circumstances are exactly the same medicines that are used to have an elective abortion. This is part and parcel of exactly the same modern medical care. And we stop making these really illegitimate distinctions between why people get medical care and how they got in that circumstance. We're going to see a little bit more clearly that this is a space where the government really shouldn't have a role. This should be about families, women and girls and their healthcare providers figuring out what the best solution is for them in any circumstance.
Thank you, Anna. I am having some vacation issues. The sun is coming up, and so Vivi is going to help me read some of the questions. Vivi, can you go to the next one, please?
Of course. Next question is from Lane. Now that 1.4 million petitions have been gathered, what can we do to make sure people vote on the referendum, especially by mail, which I understand needs to be renewed?
I'll take that one. I think that there's a lot that we can do right now. Everyone needs to talk to their friends and family and make sure that they're registered. The registration deadline is 30 days before an election. And so people can't wait until the week before the election and decide, oh, I want to go and vote in that. So the time to start talking to people about registration is now. And the same for vote by mail. The legislature recently passed a law that pushed back the deadline to apply for vote by mail. And so if you wait until the last minute, you won't be able to get a ballot and vote by mail. And so the campaign, Floridians Protecting Freedom, will have a very robust campaign effort where we will be making sure that folks know to sign up for vote by mail. People have all the information they need to go vote. But we don't need, all of us on the call today don't need to wait for the campaign. You can start by talking to your family and friends, make sure that they have, that they're going and getting registered. They can go to their local supervisor of elections. Every county has one. You can go onto their website, download all the information that you need to register to vote. You can also sign up once you're registered. You can also sign up to get a vote by mail ballot on there as well.
Awesome. Travis wanted to know that does anyone have any information about Florida medical providers and their willingness to practice in Florida if a 6-week ban is passed?
Yes, I mean, anecdotally, I know several people who've decided to practice elsewhere. I think more troubling than that is that people I know at the University of Miami Medical School have told me that they're having trouble training their medical students. And in order to be accredited, medical students need to be able to perform basic abortion services. It is considered part of medical training by every national and international medical association. In order to have an accredited program that trains surgeons, surgeons must have extensive training on performing pregnancy terminations. Right now, the University of Miami cannot adequately train its students under the 15-week ban. I understand they fly their medical residents to New Jersey and New York State so that they can go to teaching hospitals there in order to learn the necessary skills. But if you've got medical schools that cannot teach modern reproductive health care to their students, and laws on the books which criminalize medical providers for providing normal, modern abortion and reproductive health care, there is no question that we will start to see a skills desert in the OBGYN area. Any medical professional worth their salt will likely decide to practice elsewhere. And our medical schools are going to have a lot of trouble attracting students and training them appropriately.
Derek,
I'm sorry, Dan.
no. Actually, Derek, the next question I was going to ask of you, and that is, if you could share more of your story with the audience. They've asked that you do that.
Yeah, I can do that. You know, after experience over a dozen miscarriages and going through trials of IVF, you know, my wife and I were overjoyed when our 18th pregnancy reached the second trimester. You know, we had hope and a lot of faith, and you know, was telling our family members, and we even went crib shopping. Then after I watched my wife nearly lose her life, all because she was denied the medical care she needed due to the Florida 15-week ban abortion, this all could have been avoided this all could have been avoided, but you know, our government, you know, they make their laws and stuff, put their, I'm sorry guys, it's a little bit much, just a little bit, I'm sorry. But
No worries.
you know, since the government want to put their mouth on women's bodies has been overwhelming for us. You know, when my wife's waters broke, you know, I rushed her to the hospital where we received the devastating diagnosis. Her membranes had ruptured due to a rare condition known as the P-prong, which affects about 1% of pregnancies and affects Black women twice as much as white women. The doctor told us that our daughter will not survive without the amniotic fluid before 20 weeks, and she will likely be a stillborn in the next 12 to 24 hours, which I would have to play a doctor to deliver my daughter myself. Before Roe versus Wade was overturned, the standard of care for patients experiencing a potential life-threatening condition was abortion. We were devastated to lose our baby, but were prepared to move forward with the procedure to save Anya's life. However, due to the Florida's 15-week abortion ban, which went into effect soon after the fall of Roe, the doctors told us that there was nothing they could do for us. They told us Anya would have to deliver at any time, but couldn't stay at the hospital to monitor her symptoms and could only return if things got worse. Even though Anya was carrying a baby that would not survive and she was at risk for infection and hemorrhaging, we were sent home to deal with the problem ourselves. My wife went into a really dark place, believing that she would not survive. She kept the hair appointment, thinking that if she died the next 2 days, her mom wouldn't have to deal with the trouble of getting her locks done before the funeral. As I waited for Anya outside of the hair salon, which I'm sitting at right now, I got a panic attack call from her to call 911. She had delivered our baby in a toilet alone in the bathroom. She was hemorrhaging so much blood that she passed out when the paramedics arrived. She lost nearly half the blood in her body and had to be put on life support. I stayed up all night at the hospital praying and soaking the Bible with my tears. Not only did I lost my baby, but I thought I was going to lose my wife as well. Um, After we got out of the hospital, you know, Anya was still physically recovering from 3 surgeries that she needed to save her life. And we were both still carrying the trauma of this experience with us. I'm grateful that she survived, but I know that she will never be in a life or death situation trying to have our child, all because politicians want to put their mouths on the essential health care. Um, this was the firsthand um, life-threatening consequences of overturning the Roe versus Wade and the loss of a fundamental freedom. We are not alone. At least 22 million across the country have lost access to abortion care and have been stripped of the right to make personal, private decisions about their life. The abortion restrictions have nothing to do with protecting patients' health and instead but put health care providers and the impossible position and patients at risk. Bans prevent doctors and patients from making the best choice for the pregnant person in high-risk pregnancies and medical emergencies, like what Anya and I experienced. Well, decisions made throughout pregnancies must be guided by the patient's health and well-being, not politicians. The reversal of the role was just the beginning, and attacks of reproductive freedom are escalating. Politicians, Republicans, in my home state of Florida and across the nations are working to ban abortions entirely. So, later this year, the Supreme Court that overturned the Roe versus Wade will hear a case that will make it much more difficult to access medical abortion, causing 40 million people to lose access care around the world. So, our story was a wake-up call for me to the dangerous reality of pregnant people, anyone looking to conceive, and anyone who doesn't want to be pregnant in a post-Roe America. And I hope it's a wake-up call for others too, especially the men. We need to continue to use our voices to advocate for reproductive freedom and to elect politicians who will fight for abortion's access.
Thank you doesn't seem enough but thank you for sharing that story with us, Derek. Vivi, I don't know, do we have time for one more question?
Yes, I think we
Great.
do. This is a question from Amber. Is there any support from medical professionals or organizations that you know of where doctors are fighting / speaking out for abortion rights?
Yes, there are many. Most of the national OBGYN groups have organized doctors who will speak to media, who will write op-eds. There was just a tremendous op-ed by a doctor by the name of Esserman that was published in the Miami Herald. He's a local guy here in Miami-Dade. He practices in South Miami. There's also a group of medical students for choice. They're active on the University of Miami campus. I would imagine FIU's medical school has those people as well. So there's no question that people who are trying to provide services know that this is important and they want to engage with the medical process.
Right. Vivi, can we, okay, great. So I personally want to just thank all of our panelists, Ashley, Betsy, Derek, Anna. Thank you so much for being here. Thank you so much for allowing me to help guide this conversation. I'm going to give it back to Maria to close out this month's collaborative. Maria?
And I cannot thank you enough, Danielle, and everyone here for all that you do. There are many of you in the audience today who are also extraordinarily active and who we all trust to take these trusted sources' voices to amplify them within your own networks. I think if we want to honor the cooks, if we want to honor you, Ashley, honor everyone who has shared their stories, that's the thing that we can commit to doing, is to making sure that your stories and your voices get heard. So I'm going to ask that in 2024 from each of all of us. We help you to do that here at Women's Fund, so you can join up with Camila, who runs these amazing impact collaboratives, to be part of our volunteer corps and help focus you on actions to take, and help us with our public awareness campaigns. Our third program that we didn't talk about yet today, but we have amazing public awareness campaigns that you can help us to amplify. You can fuel our work and our mission and help these thought leadership convenings to continue to happen. And then we can also come back here. Please join us in this village square. It's your Women's Fund, and we convene here once a month, same time, same place, but different, absolutely important targets. So human targets, trends in trafficking, recruitment, as Camila and I are part of the South Florida Human Trafficking Task Force and the Miami-Dade Coalition for Human Trafficking. They're dangerous trends, and our kids are getting targeted via TikTok and all kinds of other stuff. So maybe we don't want to know, but we need to know. and we need to amplify those voices to our network. So we'll see you same time, same place next month. Thank you all for being you and being part of your Women's Fund.
Thank you.
Derek, we love it that you are taking care of kids and taking care
Yeah,
of your wife as you're sharing your valiant story. So thank you. Thank
You're
you for
welcome.
our hearts into your wife, most certainly.
I'm actually watching my little 4-month nephew. He's right next to me inside the truck, so I gotta speak so low. At first I was outside, but now my wife is on the inside getting her hair done, so it's like he's right next to me. If I wake him up, I'm gonna have to go to it.
Amazing, amazing, amazing. Well, thank you. Thank you so much. Betsy and I, we could have had some, stories for days, right?
Yeah, I mean, yeah, I was getting a little tongue-tied. I was like, wait, but no, yeah.
Incredible. Well, thank you all so much, and I hope you feel like this is home. That we're all connected. We're at your service. Danielle, you're the best.
You're the best. Thank you, guys.
You're welcome. Thank you.